Hello, my name is Hiba Salman, and I'm doing my master's in public health at Northeastern Illinois University. I'm excited to present my research on lung cancer prevention policy in elderly population, focusing on the state of Illinois, USA at this seminar. Through this research paper, I'm looking into how we can improve the lives of older people with lung cancer. The idea is to fix problems like too much treatment and not enough people getting screened for cancer. Through this research, we suggest doing more screenings, letting more people qualify, and making sure everyone knows about what the risk and screenings. The ultimate goal is to enhance survival rates and relieve the physical and financial burden of lung cancer on the elderly population of the United States, especially the state of Illinois. Let's now let's discuss the background. Through WHO resources, in 2020, cancer caused about 10 million deaths worldwide, with lung cancer leading in global cancer related death and ranking second in new cases. The American Cancer Society estimates the proportion of 238,340 new cases and 127,070 deaths from lung cancer in 2023. Advanced lung cancer, characterized by uncontrolled cell growth, typically has a grim prognosis with an average survival rate of around a year. Now, let's start with the background. Through WHO resources in 2020, cancer caused about 10 million deaths worldwide, with lung cancer leading in global cancer related deaths and ranking second in new cases. The American Cancer Society estimates the proportion of 238,340 new cases and 127,070 deaths from lung cancer in 2023. Advanced lung cancer, characterized by uncontrolled cell growth, typically has a grim prognosis with an average survival rate of around a year. Elderly individuals, especially those with small cell lung cancer (SCLC), face notably shorter median and survival time compared to other cancers. When we talk about lung cancer, it's not just a health concern for one person, it's a public health issue. Survey tell us that more and more people are dying from lung cancer. This is a big problem and we need prevention policies. But why is it a public health issue? First, when someone has a lung cancer, they often face early death. The treatment like chemotherapy and radiotherapy can be really tough, especially for older people. This is a big deal for everyone, not just the person with cancer. Second, the test to find out if someone has lung cancer can be expensive in the US. They also take a lot of time. This means not everyone can get these tests easily. So it's not just an issue for the person who might have cancer, it's a problem for everyone in the community. That's why we need to think about it is a public health issue and find ways to prevent it. What preventions can we follow? Let's talk about the government funded lung cancer screening program. It's about giving free or cheaper screening for more people, making sure everyone can get checked. We want to do good, but it's not easy. Costs are high, things get complicated, and some insurance companies might not like it. High risk group recommendation. Next up, we are looking at a lung cancer screening recommendation for high risk group. We are trying to teach adults more about it so we can catch problem easily. It's a good plan, but it depends on people thinking, talking action, and it might not reach everyone at risk. Policy development for screening. Now let's focus on making rules on and plans for the lung cancer screening program. We want our decisions to be based on good evidence, and we are thinking about using taxes to pay for it. It's a smart move, but we have to deal with laws, convince people it's a good idea, and be mindful of what taxpayer thinks. Policy enactment. To make a law about preventing lung cancer in Illinois, there are some important steps. People who want free lung cancer screening must meet certain rules, and the money for this come from taxes. The new law idea is first shared with the leader in Illinois, and they send it to a group of check it carefully. The group talked to regular people, experts, and other in meeting to hear their thoughts. After the group decides, the whole group of leaders talks about it. If most of them agree, it goes to the leader of Illinois to sign. When the leaders sign, the new program starts. This way, the law is looked at a lot and listened to what different people think about it become real. Policy implementation. To put the plan of giving free lung cancer screening into action, we need few things. We need funds to run screening program for people without insurance or with less money. We need a team of folks to help run the screening program. We need things like computer and paperwork to keep track of appointments, patient records, and work with healthcare providers. We need ways to tell people, especially in areas where there might not be much information about these lung cancer screening programs. In conclusion, this policy recommendation underscores the critical importance of early detection and proper treatment in tackling the pressing issue of lung cancer among the elderly. By focusing on accessible screening program and raising public awareness, our goal is to improve patient outcome, reduce cost, promote social justice in healthcare. Together, we can take meaningful steps toward a healthier future for elderly population, ensuring that the impact of lung cancer is minimized through timely intervention and community engagement. In the end, I want to thank California Institute of Research and Technology and my mentor, Dr. Bernie, for giving me this opportunity.